So I'm Kelly Brooks-Lindsey. I'm the Senior Health and Human Services Legislative Representative at CSAC, and my job is to welcome you this morning to the CSAC Conference Center. We're very pleased about the partnership between CSAC and Californians for Safety and Justice, and looking a little bit closer at what's been going on within counties on enrollment of our criminally involved populations into Medi-Cal. I think the ACA offers a lot of really wonderful opportunities for us to rethink how we're delivering healthcare services to folks, particularly to folks involved in our jail and probation systems. And I'd like to welcome our partner, Elizabeth Siggins from Californians for Safety and Justice. Thanks.
Thank you so much to CSAC in particular, and Elizabeth and Kelly, for all your help, not only getting today happening, but with the survey in general, and we'll be talking obviously a lot more about that. I just wanted to do a brief welcome on behalf of Californians for Safety and Justice, and then just set the stage for today, and then I'll be bringing up my colleague, Jenny Montoya Tansey, who will be doing our presentation. For those of you who are less familiar with Californians for Safety and Justice, we are a nonprofit organization that is focused on promoting public safety by implementing smart justice solutions that reduce crime and cost less money, ideally even save money. And there are a number of parts of our work that you won't be hearing about today, so I just wanted to touch on it briefly just to make sure you have a sense of the broader work. We do a lot of public education and advocacy. We actually helped to start the largest crime victims network in California, over 6,000 crime victims and survivors of crime who are really committed to promoting rehabilitation and other alternatives to create safer communities. And then what we're really going to focus on today is one of our local safety solutions projects. So from the beginning, Californians for Safety and Justice has been committed to promoting solutions, not just working against things that don't work, but really trying to identify and promote solutions. So we do this at both the state, but primarily at the local level. We are grateful to have some of our partners from CDCR here in the room. We have been working with the California Department of Corrections and Rehabilitation, particularly around some enrollment issues. But our local safety solutions include a number of areas. We work on looking for policing solutions, innovative policing solutions. One of our advisors, Tom Hoffman, is here today, and Tom is a former director of parole with CDCR and also former assistant police chief, and works on identifying local solutions that are redefining community safety and promoting better policing activities locally. We also are doing some pretrial work, and we work with Crime and Justice Institute on that, promoting, again, locally a number of solutions that help to reduce and address the pretrial populations in our local jails. But today we're here to talk about our Health Matters project. And our Health Matters project got started a couple of years ago because of the amazing opportunity that the Affordable Care Act offers both the counties and the state government to implement solutions that can create health opportunities at the same time as reducing recidivism and improving rehabilitative outcomes. We have been very lucky in our Health Matters work to partner with a couple of organizations that are here, and I just want to give a shout out to those. California Forward, Kathy Jett is here today with California Forward, as well as the Community-Oriented Correctional Health Services. We worked with those two organizations, and Nan Torrey is here from Coaches over there. We worked with those two organizations over the course of last year in doing a number of regional convenings across the state to really call attention to and do a lot of education around the opportunities that could be provided through the Affordable Care Act, particularly with criminal justice populations. Before we go forward, we wanted to get a sense of who's in the room. So there are a couple of, people may raise their hands more than once, but if you could let us know how many folks are here sort of working more on statewide issues. I'm going to ask statewide or local issues. So statewide issues, how many folks focusing? Great. How many people more with local issues? Okay, great, good. And then sort of in terms of whether or not your primary focus is more on criminal justice issues or more on health-related, including all of the behavioral health issues. So how many folks, your primary emphasis is a little more on health-related issues? Great. And how many are focused more on criminal justice issues? And part of why we're here, right, is because we want more and more people, seeing we work on both. And that was really, I think, one of the major challenges initially to this work, and one of the opportunities that it's creating, right, is more chance to work together. So that's really helpful. A couple of other people I want to be sure to thank. Will Ng from the California Endowment is here. So Marcel, the California Endowment helped to fund the survey, and I've actually helped to fund, along with the California Wellness Project, our overall Health Matters project. So thank you very much for making this possible. We're all looking forward to the preliminary results out of this. There are two things on your table that I also want to call attention to, and they look kind of similar. So one is a toolkit that we released last year, and that was when you first sat down sort of more in the center of your table, and it's a multi-page document, and then there's a two-page document that is really kind of an overview of a highlight of the survey that Jenny's going to be talking about today. But before I introduce Jenny Montoya Tansey, we're so honored to have Assemblymember Nancy Skinner join us today. And so I'd love to have her come up and say a few words. Thank you so much for your leadership and your commitment to these issues, and helping to really forge ahead with the work that's brought a lot of us here. Thank you.
Morning. It's not yet noon. Great to be here. And I just wanted to also give my thanks to Californians for Safety and Justice, because I think they're a very, very important organization and very effective organization, and so needed right now. Obviously we're concerned about how to stop the revolving door, and for those folks that we have incarcerated at some point or another, trying to help make sure that they are reintegrated in our community successfully. But I think we also need to address that we're sending too many people into prison in the first place, and the incredible impact that has on every layer of our community. I mean, clearly, if one of your family members is in prison who otherwise might have been contributing to the household income, that impacts the family severely. Obviously, if that family member was a parent, it impacts the children. Just the layers and layers and layers of impact onto our community, let alone the budgetary impacts to the state. The more we can do to address that circumstance. And we have to really look at ourselves, because to be the country that has the highest percent of your adults incarcerated across population-wide is just not something to be proud of. So it's something that we all, I think, are engaged in. But I was asked today to come and share with you because I was the author of the bill AB 720. And 720, our hope was, and I'm not going to start out saying that I just love mandates, but our hope was that actually we would expect or require counties to enroll their folks in the jails into Medi-Cal 30 days before their release, if those people were eligible. And our purpose in that is, just being practical. Look, once you're released, the first thing on your mind is not making sure you have Medi-Cal, because you maybe you have a housing obstacle. Obviously, you have an income obstacle. There's so many other things that are on your mind that Medi-Cal is not way up there on the top of the list. And yet, if you are enrolled in Medi-Cal and you have any number of chronic health issues or substance abuse or anger management or you name it, that may have led you to be part of one of the major factors in your being incarcerated in the first place, then clearly if you have Medi-Cal, you're going to be that much more equipped, and you go to see, you get either the health attention you need or the psychological attention you need. You're going to be that much more equipped to be able to successfully re-enter into our communities. Well, we were not able, partly because there's always a cost with a mandate. We were not able to do the bill as a mandate. We did it instead sort of as an incentivization and stripping away any obstacles to encourage counties to, for those, we tried to make the case for why it's important and then also make it easy for those willing to be able to enroll folks in a Medi-Cal 30 days before. So I was very, very pleased when the bill passed our two houses and when Governor Brown signed it into law. And I know from the work that the Californians for Safety and Justice done, they're checking in with counties now to see what kind of progress is made. I need to be a little more in touch with my own two counties. I represent 50% of my district is Contra Costa County, 50% is Alameda County. I want to try to interact with them more to try to get their participation in this a little higher. And then the other thing I just wanted to mention is one of the things my district office has done over the years and annually is join up with lots of different community organizations and the county in both of my counties to host clean slate events. And obviously helping to seal someone's record if they're eligible to have it sealed also really helps with their stopping that recidivism. But one of the things that we encountered in doing our clean slate events is really, because part of what we would do is bring lots of different community resources, job resources, education resources, even medical resources to our clean slate events. We would get from the people we worked with a real clear communication of need. So from folks who are formerly incarcerated about different health issues, and they're not having yet satisfied or either had their the Medi-Cal or the access. So we found that it reinforced the need for this bill and for just general work on ensuring that people have health care and then additionally access to health care. Thank you very much.
Again, thank you so much for your leadership, Assemblymember Skinner. The reason Californians for Safety and Justice started the Health Matters Project is because so many of us know that often what's underlying criminal behavior is actually someone's mental health or drug addiction issues. And the Affordable Care Act created a really unprecedented opportunity for us to invest more resources into creating really some real treatment alternatives at the local level and increase access to care for so many. So over the last year, a number of us in this room and outside this room have been going up and down the state trying to talk about this and extol the potential opportunities of the Affordable Care Act. Up until now, we haven't really known how much that's taken off. And so I am not going to steal Jenny's thunder, but there's a lot of good news in this, and so we're really excited to present this. We are hoping that this morning will be a very interactive engagement, so please do feel free to ask questions throughout. I would like to invite up Jenny Montoya Tansey, our Health Matters Project Director. Before coming to Californians for Safety and Justice, Jenny worked for about 4 years with the Obama administration at the U.S. Department of Agriculture, and she is probably through the work over the last couple of years worked with well over 30 counties in terms of doing this healthcare enrollment work through the regional convenings that we did with Cal Forward and with coaches, as well as the direct work that she's been providing, direct consultation to both Los Angeles County, both probation and sheriff's departments, and also CDCR, and then a number of other counties through training. So we're excited to have your expertise, Jenny. So thank you very much.
Okay. So as Elizabeth said, we're really excited to have some more comprehensive information about what's going on at the county level with health coverage enrollment for California's local criminal justice populations. And so first, we've kind of set the background a little bit, but for this presentation, I'll just go a little bit into sort of what's been happening over the last couple of years that set the stage for the opportunity that counties are seizing now. Then we'll talk a little bit about the survey methodology and how it was fielded. We'll have the bulk of the presentation on early survey findings, which I think are pretty fascinating, and then talk about where we go from here. So, as you're well aware, the combination of two really important transitions in California has sort of made possible that's work that's being done now. One of those big transitions was public safety realignment, which of course, as you're aware, transitioned a lot of responsibility for nonviolent, non-serious individuals to local jurisdictions from the state. And it also, I think, increased the level of inter-county collaboration that was happening through CCPs, through community corrections partnerships. There was a lot more sort of collaborative work going on between local county health departments and probation and sheriff's departments that I think sort of set the stage for some of the enrollment work we're seeing now. Affordable Care Act implementation in California has clearly been really important here. First of all, the fact that people in local criminal justice populations were largely not eligible for health coverage previously and now are eligible. Our states also opted to enhance particularly some of the substance abuse benefits that are available under the Medi-Cal program, and that's clearly really important for a population, the majority of whom suffer from substance use disorders. And then we've got a lot of new federal funding for health coverage, which is a great opportunity for our state and for counties to take advantage of. So last year, I think, with respect to criminal justice population enrollment, was sort of a preparation year. Obviously, the Medi-Cal expansion that was signed into law last year was key. AB 720, which Assemblymember Skinner authored and Californians for Safety and Justice co-sponsored, I think was really important in sort of raising awareness around the state about the opportunity. AB 82, which as many of you probably know, was some really important funding for Medi-Cal outreach to vulnerable populations, including reentry populations, as well as some funding for in-person assistance for Medi-Cal enrollment, which the California Endowment contributed to. Brought some resources to the table that certain counties have been able to take advantage of for this work. And then there was a lot of county trainings on ACA and its intersection with criminal justice, not just through the organizations that Elizabeth mentioned, but also CSAC put a lot of energy into that issue through the Joint Training Partnership, and I think that was really important in raising awareness as well. And then a lot of counties did some local planning and particularly pilots last year through their low-income health programs. So I couldn't list all of them, but I know Santa Clara, Los Angeles, and San Diego, for example, were all very active in terms of piloting enrollment in their jails and through their probation departments last year. San Bernardino County also did some enrollment through probation last year. And that sort of helped people understand better how they could streamline their enrollment processes within a custody environment, and provided the opportunity to spread some best practices or some emerging promising practices. So to find out, 2014, Medi-Cal expansion is in place. Who's really doing work with targeted enrollment of jail and probation populations? We fielded this survey with actually some assistance from CSAC to distribute the survey to CAOs in 58 counties in California. When I wrote the slides, 44 counties had responded to the survey. We've actually had a couple new responses that have come in since then, and I'm hopeful actually that that'll continue to climb throughout the month. But we have a really good representative sample of counties representing 96% of California's population. So we really, through this survey, do get a good sort of snapshot of the opportunities in most counties in California. Some of you probably have filled out the survey. I think we have some county folks here today. But for those of you who haven't seen it, we asked about enrollment of county jail populations, enrollment of county probation populations, county efforts to reach other criminal justice populations for health coverage, so that includes state parolees, misdemeanants, other people through the courts, out of custody defendants, And then we talked a little bit about the next step, which is really important post-enrollment efforts to actually connect criminal justice populations to treatment opportunities in the community. And then we also asked about what are some of the barriers that you're encountering. You know, if you're currently providing enrollment assistance, what's challenging you right now? Here are some key findings, and then I'll go into a little bit more depth on them. First of all, this is like the big headline. All 44 counties that responded to the survey are doing something. They're either currently providing enrollment assistance to their local criminal justice populations, or they're actively planning to start providing that assistance. And actually, some of the counties that responded in June, we asked when you're planning to start. So some have actually begun since they submitted the survey as well. There's a range of enrollment strategies. We'll talk a little bit about how some of these programs are structured, staffed, and resourced, but there's a lot of diversity of strategies that counties are employing. And then some counties are, as I said, really taking the next step and beginning to connect people in the justice system to covered treatment. And actually, we're really excited to see that some are actually already starting to see savings in the justice system based on that connection to treatment. So I'll talk a little bit about that. We have a portion at the end where I'll kind of talk specifically about a few counties that we want to highlight. And then there's some challenges which we'll go over at the end. The numbers are mapped fairly similarly for jail and probation, but currently about 70%, or exactly 70% of counties that responded to the survey say that they are now providing enrollment assistance to individuals on probation and to individuals in their county jail. Now, there are some counties who also, in addition to currently providing enrollment assistance, have plans to broaden that effort over the course of the year. So maybe right now they're hitting their sentenced population and they're planning to expand to their pretrial population. But 70% are currently hitting some portion. Yes?
When you refer to individuals on probation, do you mean specifically probation or supervised by probation departments?
I actually, yeah, that's a really great question, thanks. So supervised by local probation, so that includes PRCS and mandatory supervision, et cetera. And actually, you'll see when we look at what populations are being targeted, there are some counties that are really focused on the PRCS population.
When you say enrollment assistance, does that cover the gamut? Like some people are getting paperwork filled out, some people are getting an actual card. I mean, kind of where's the... Yeah,
so enrollment assistance refers to like in-person help to apply. Some programs are structured, for example, in a jail, so that ideally people will have a temporary card when they leave. Others, it kind of depends on what population people are focusing on. Varied lengths of stay sort of set the stage for different types of programs, but this means that somebody is helping you apply for Medi-Cal, basically. Yes?
I just wanted to follow up on that remark because I think there's actually three large planets colliding. It's the criminal justice, which I'm not even going to say that right, and health, and eligibility, which
Yep.
is a completely different
Yes.
world all its own, and they're completely rocked, right?
That's a great point.
And they barely know how to do with health, which we've been working. Anyway, it's good to remember
Yes.
that there's this other whole world where you can help and help and help, but if they're not able to take the data that's available and run it through their system and be
Yes.
efficient, it's another partner who...
Yes, absolutely. Yeah. So social services is a huge partner in these efforts, and a huge piece of the puzzle. And we'll talk about that a little bit in a second. So this is just some information around who's being targeted within jail populations. First of all, so 17% of counties that responded on jail said that they don't have a specific target. Their aim is to hit all people in their county jail. The rest of the counties clicked multiple boxes for different populations that they're trying to hit. So 17 counties said that they are specifically focused on sentenced individuals in their jail, and they may be focused on a couple of these. So it might be sentenced and mentally ill, or sentenced and inpatient. Then we've got a little bit smaller amount of folks who have that specific focus on mentally ill inmates, and then a smaller amount on pretrial It's interesting, I think, the distinction between sentenced and pretrial. First of all, shorter lengths of stay and more uncertain lengths of stay can make it challenging to hit pretrial individuals. And then I also think that some uncertainty around state policy on enrollment of people when their release date is uncertain is also a challenge that's impacting counties' ability to really focus on their pretrial populations. But as we can see here, there are some that do have that focus and that are working with pretrial inmates. The other category captures a few different groups. Some counties don't make a distinction per se between sentenced and pretrial, but they're just hitting everybody who they know is 30 days out or 90 days out from a release date. Also, some counties who are really focused on connecting to covered treatment are focusing some of their enrollment efforts specifically on groups that have been screened and are awaiting a placement into residential treatment. So they see enrollment into Medi-Cal as really critical to their ability to place somebody into an alternative program. And then we saw there were a couple who actually had a specific focus on the AB 109 population. And then this inpatient component here I thought was interesting. So I actually expected, oh wow, we've got so many counties who are doing this work with inmates. I bet there'll be some group of them that are going to start with their inpatient population, specifically because there are some immediate cost savings to be achieved there. However, what I found is there's actually only one county that said they were just focused on inpatient. Everybody else who's doing inpatient is also doing some form of pre-release enrollment assistance as well. Does anybody have any questions on this slide? Yes?
Hey, what is inpatient?
Thanks for clarifying. So basically, as some of you probably know, Medi-Cal doesn't cover healthcare costs while someone is an inmate, with one exception. It will cover an inpatient stay in a community hospital, in a non-correctional hospital. So the state, there's a state law in place that is just now actually starting to be implemented around county claiming for inpatient costs for inmates, and so that's why some counties have a real focus there.
Just to clarify, it's not being implemented yet.
Well, yeah, it's in some initial stages.
The counties are waiting for the department is not yet released protocol.
Fair enough, but yeah, so both, it's in the process. I guess counties are looking towards that now. Yes.
When you're talking about pretrial enrollment, you referred to, if I heard you correctly, something about some state policy being a little bit unclear about enrollment for people who don't have set release dates. Did I hear you correctly? Or?
Yeah, and I'll talk about that a little bit. And we have actually some of our friends from GHCS here, but basically we're working, I think, sort of, because this is new for everyone in terms of figuring out. So we've got some guidance out on how enrollment works for a sentenced population in CDCR, where a release date is more well known. And I think counties and the state are thinking through sort of with a county jail population where release dates are more uncertain and lengths of stay are shorter, how do we make sure that we're able to help the greatest amount of people, and also that we're that we're sort of being effective in terms of making sure FFP isn't going for inmate care, et cetera. So that's sort of something that we're working with DHCS on. Okay, so target populations for probation. Most counties that are working on probation-based enrollment said that they're hitting all probationers, that they don't have a specific target population. But there were others that said they're specifically focused on AB 109, some that said they were specifically focused on felony probation as sort of distinct from AB 109. One thing that was really interesting, I thought, that we heard from a lot of probation departments is that they saw how successful connections to treatment could be when they received AB 109 resources to connect that population with some more community services and health services, and that they saw Medi-Cal enrollment as an opportunity to sort of extend some of that type of opportunity to their felony probation population. And so I think that's why we see a specific focus on felony probation in some counties. And then others were specifically targeting some of their mentally ill or drug offender caseloads for enrollment, presumably because they were then going to connect them to covered treatment. Any questions on the probation side? Okay. And actually, there were some other responses for probation too. There are some that were specifically focused on risk level. So they had a goal to enroll all their high risk or all their high and medium risk probationers into coverage. Okay, so then other criminal justice populations. I was surprised and happy to see that there were actually a lot of counties that were reaching other criminal justice populations, including 13 that said they were actively assisting state parolees with health coverage enrollment. And there's a variety of ways that counties are doing that. 7 said that they were assisting individuals in their specialty courts. And 3 had programs to assist misdemeanants. I'll talk a little bit about one county that's doing some of this work, which is Ventura County at the end. But I think a special focus within the courthouse is something that Ventura and a couple of other counties are doing that I think is really interesting way to reach a broader criminal justice population. Any questions about this? Okay. Okay, so here we get into a little bit of who are the players in these efforts. And what we found is, first of all, that they're highly collaborative. Counties report an average of 4 county agencies or community organizations involved in efforts in their county. And some of the agencies that were included are CAO's offices, sheriffs, probation departments, social service agencies. That's actually probably the largest group because it crosses both jail and probation. Health departments, including behavioral health agencies. Some counties reported that their Medi-Cal managed care plan was involved. Local clinics and community organizations. Some are working with their jail medical services provider, whether that's a contractor or a county entity. And then within the other criminal justice populations group, public defenders, district attorneys in the courts, and CDCR were all involved. And actually, public defenders, at least in a couple counties that I've spoken to, are involved also in the jail. It's been really interesting. I think sort of applying some AB 109 funds that went to public defenders to fund an enrollment assister in the jail, which is pretty interesting. So yeah. Let's see here. So here we get into funding. I thought this was really interesting. We asked how counties were paying for assistance in jail or at probation offices, and this is actually for counties that are currently providing enrollment assistance. So not speculative, like we hope to use X source of funds, but counties that are using these funds presently. So we had almost 10 counties that received an AB 82 outreach grant, and either the sheriff's department or the probation department is involved in that grant, so they're using it for their population. Then we had just a few who are using the Covered California In-Person Assistance Program, and I think part of the reason that number isn't as high as we might expect is because jails, as you'll see later, are largely using the paper application. They're not as plugged into to Covered California as a portal for applying. And then county general funds, a few are using county general funds. I think that's also includes a number that are just sort of absorbing these costs into the budget as it exists. And then the County Medicaid Administrative Activities Program, if you're not familiar, that's a federal state reimbursement program where you can claim and get 50% reimbursement for certain activities, including Medi-Cal outreach and enrollment. There are a few probation departments in the state that claim MA, and then also some other health and social services departments that may be using that source of funds. Then administrative funds for Medi-Cal eligibility, so this is just the money that goes to social service departments, I think, to pay for eligibility workers, et cetera. And then many counties are using some AB 109 funds. And a lot of counties are using these funds in combination. So it's not like they're exclusively using one or the other. But I did think it was interesting that a lot of counties have chosen to devote some AB 109 funds. And some of them are actually counties that already had, say for example, some reentry staff in the jail that were being paid for by AB 109, and then Medi-Cal enrollment assistance has been added to the work that they're doing. And others have decided they have like new AB 109 money that they've chosen to devote to this purpose. Okay, so we asked a little bit about the scope and scale of efforts. And I think what we see, so we asked about how many people do you plan to enroll in jail in 2014 and in 2015. So part of what this data shows us is that we have some really, really, really small counties and some really, really large counties in California. But we've got our 2014 number in blue and our 2015 number is in orange. And some counties are starting enrollment assistance mid-year in 2014. Others are just planning to scale it bigger in 2015. But what we see here is that the counties that are doing 1 to 100 is going to go down in 2015, and then the other categories are going up. So counties are basically planning to grow these programs in 2015. And then to give you all a sense of sort of what size programs different counties have, what I did, and I acknowledge this is sort of an imperfect measure, but basically what I did is I just took the counties that said they were planning to enroll 1 to 100 people in 2015. I looked at their average daily population through the BSCC dashboard, and I just averaged it. So that's like however many counties, maybe 8 counties, I averaged their average daily population, and they have very small jails, 136 on average. And then for our group, I just did the same thing for each of the other categories. So projected 2015, 100 to 500, we've got an average daily jail population of 569, and then we see like for our more than 2,000 category, we've got a pretty large average daily population, and LA is in that group, so they're actually dragging the number pretty high. But 5,000 average daily population for that category. Any questions on this? Okay. So for probation, we have some similar numbers, and we can see there's actually, we see basically the same trend. So counties maybe that are doing 1 to 100 this year are planning to do 100 to 500 next year. Counties that are, a couple counties that are doing 100 to 500 next year are planning to do 500 to 2,000 next year, et cetera. And then we also have a little bit larger group of counties that aren't doing enrollment assistance for probation this year, but are planning to do it in 2015, that are in that NA category. And then they're incorporated into the 2015 categories. And then because I don't have average population for probation caseloads, I just took the average total county population to take this very rough measure of how big the counties are that fall into these different categories. So this is not the average number of people on probation, that would be crazy. This is the average number of people that live in the county. And we see the same trend, just basically that counties that have small programs are smaller counties, and counties that have large programs are larger counties.
When you say on probation, what do you mean? Actually supervised, or on just order on the probation? Because those two numbers would be vastly different.
Yes, they would be. And I don't have figures for either of them. So this is just the figure of the total county population overall.
The whole conversation is, when you say someone's on probation, does that mean they're assigned and they have an agent working them, or they bank, which is
right.
Where could be 85% of the people on probation in the county get banked?
That's a great question. And basically, the reason that I asked for hard numbers for the scope of people's programs, so we're planning to enroll 500 people rather than asking for a percentage, is because I think it's really tough. You know, counties may have different definitions of who they would include in, like, you know, we're trying to enroll 50% of our probation population. Is that including your banked caseload, or is it just people who are actively supervised? That's why I asked for hard numbers instead. But I would say that there are a couple of counties that I know of that are making an effort to reach their banked caseloads, whether through, there are a couple counties that, you know, might have people come in and just put a handprint to report, but they never see a PO. And they have information in the computer that tells them if you want to enroll, here's the closest place that you could go do it. So there are some a little bit less intensive efforts to reach that larger group of probation in some counties, if that's helpful. Okay. Okay, so what application does the county use for individuals in jail and on probation? Actually, this slide includes probation and jail. So we saw very high number of counties are using the paper application in jail. And that's partly because of internet connectivity issues in jails. And then I think it's also because of some issues in certain counties with getting the online system to work for people who are currently incarcerated. And then, let's see here. And then we see a little bit larger group of counties for probation are using their county online application, and I think that's basically due to the personnel that's doing the work. So where county eligibility workers are doing the work, they're more likely to use that system. Okay, so now this is like the really exciting part, I think, of the information that was gathered. We have a sample of what some counties are doing that kind of stood out to us that we thought was interesting. So San Diego County, first of all, as I mentioned before, they got an early start on their jail applications. Last year, they did a pilot where they enrolled people into their low-income health program. They're now scaling that effort to reach a broader number of people in their jail. And one thing that I thought was really interesting was that they're going to be offering a pre-enrollment ACA and Medi-Cal workshop for people who are part of their reentry program, which basically explains how to access benefits, what's covered, what are some of the benefits of enrolling in Medi-Cal. And I think there are other counties that I've spoken to who are seeing some portion of their population who's not interested in applying for Medi-Cal. And I think this is an interesting strategy that could potentially be helpful to counties that are encountering that problem in sort of increasing the interest in participating in Medi-Cal. And also providing some really important information for people who may not be used to the system and need a little help figuring out, how do I get a primary care doctor? Can I change my doctor if I don't like them? Sort of a little bit of an orientation to benefits. Merced County, which I actually think we might have somebody from Merced here. Cool. So they reported that, and I don't know if this was you that reported this, but I thought it was interesting, that they're targeting individuals with longer stays, mostly sentenced, for in-custody assistance with a Medi-Cal application, but they're also providing referrals to social services for everybody who comes in to the jail. So that's sort of the method they're using right now to reach their pretrial population and folks who have a really quick stay in the jail. Shasta County, I spoke with a couple of people in Shasta who told me about a really interesting jail health and wellness initiative that they have that's sort of more comprehensive. It's not just focused on enrollment, but it incentivizes certain healthy behaviors, including filling out a Medi-Cal application. That they provide credit for a lot of stuff, whether it's participating in parenting classes, completing a treatment program while in custody, and it also includes a couple of days of credit for completing a Medi-Cal application. So that's obviously a great incentive for people to apply. Placer County, I need to find out more about this actually, but I thought it was really interesting. They're using existing county data, and that's actually both social services and booking data, information they have in their criminal justice databases to pre-fill health coverage applications, and actually reported that in some cases they just need a signature from the individual to submit. So that's really making their process a lot more efficient. Ventura, as I mentioned, is making some big strides in reaching people that are never in their jail and may not be on probation. So they're doing presentations in court to out-of-custody drug and alcohol defendants about Medi-Cal. And then they're distributing application packets in court and collecting them. And they're also doing Medi-Cal outreach at the public defender's office in Ventura County. Yes?
I just want to be clear on things like, for example, Placer County is saying all you need is a signature.
Yeah.
They sign it, or is whoever the person is helping them is submitting the application and doing everything else?
Yeah, exactly. So they're probably, I actually need to talk to, like I said, I haven't actually spoken on the phone to somebody from Placer County about that effort. But what I would presume is that they're serving as an authorized representative in some form or fashion for the individual who's applying. Okay, just a few more that I think are pretty fascinating. So Yolo County, first of all, has some really great clinic partnerships that they used to enroll their high and medium risk probation caseload. They actually have partnerships with 3 clinics in Yolo County who've rotated, coming into probation offices and providing in-person assistance. And then they also have started to see some cost savings, which actually we're going to have a webinar about on Wednesday, and Yolo County will be sharing a little bit more information about this. But basically, they've worked with their treatment providers that they have contracts with in probation to make sure that Medi-Cal is sort of the coverage of first resort, and that probation becomes the source of funds of last resort to cover treatment. And they've seen some fairly significant cost savings since the beginning of the year. I think when I spoke with them in July, I think it was about $100,000 in savings on their probation contracts based on that change. And based on the fact that they've enrolled their entire medium and high risk caseload. Santa Clara County has a reentry center, and they're actually another county that got started with enrollment last year, or I actually think they may have started, they probably started the earliest of anyone. And their reentry center serves people who are exiting jail. It serves people who are supervised by probation, and it also is a point of entry for state parolees. So they reach a lot of populations there, and they not only do enrollment assistance, but they also have some case management functions. So I think for counties that have day reporting centers, we're seeing a little bit of movement towards providing some of these services in an integrated way at that site, and Santa Clara County is a good example. And then LA County, our big dog county, is working on sort of developing some scalable and sustainable models for reaching a very large population. They are doing jail enrollment assistance with sheriff's staff, with custody assistance, and they're integrating some targeted discharge planning through their jail medical services. And then they have a similar model to Yolo County in terms of reaching their probation population. They're working with clinics that are nearby each probation field office to come in and provide that enrollment assistance, and also potentially a link to a provider. So I think we're getting close to noon. And I want to leave time for questions, but just really quickly, I said, as I mentioned before, we asked counties some of the issues that they're encountering in getting these programs off the ground. And so system upgrades, much like I think probably if we quizzed counties about anything related to health coverage, that's going to be a topic, and it's something that the state and counties are working hard on to get all of our systems up to, so they're running smoothly and processing applications. A lot of counties reported some issues that they were having around information sharing between county agencies, and I think this is actually also a problem that doesn't just relate to health coverage enrollment, but it's something that's emerging more and more as county health departments and public safety departments and social service departments are trying to work more closely together. What are some of the challenges that they're encountering around HIPAA, privacy in general, and sort of trying to figure out how they can get the ball done while protecting people's information. So then a couple of counties also mentioned, would really like to reach our pretrial population. We need some solutions, that can work policy-wise in terms of inmate applications that don't depend on a known release date, because for pretrial, as we know, that we just don't typically have a date when we know somebody's getting out of custody. And then a huge thing that people mentioned, not specifically related to enrollment, but very linked to sort of making this whole puzzle come together, is that additional resources are needed for housing and intensive case management, and that's really, basically to make treatment programs and health treatment more effective. And then provider capacity and current limitations on residential drug treatment. I think, those are issues that have been well known in the behavioral health community for a long time in California, but as public safety agencies get more engaged in these issues, I think they're also, posing a larger and larger challenge for those groups as well. And so those were some of the highlights that counties reported in terms of issues that they're encountering. Okay, so I just wanted to really quickly let you know sort of where we're going from here, where Californians for Safety and Justice is going from here. We're doing some additional research based off of the surveys. I'm actually, and I have a little team of folks who are helping me reach out to every county that responded to the survey to do a bit more of an in-depth interview to understand how the process works. And we're learning as we go through those interviews a lot of really creative things that counties are doing to improve this process. And then, so out of those interviews, as we collect sort of some of the promising practices and creative solutions that are emerging, we're going to be spreading those to other counties through peer-to-peer learning opportunities. So I think the structure for that is still sort of evolving, but I'm hoping to do some calls where we have different counties that have sort of cracked the code in one area share with others what they've learned. And then I think just overall, really what came through for me in terms of what counties are going to be facing in 2015 as they really move deeper into this work, the treatment capacity issues. As we, increase the demand through enrollment, there's just going to be increasing issues around treatment capacity, and I think that's something that we'll really need to work on addressing. So, does anyone have any other questions? Yes.
Could you explain a little bit more of the release date issue? Is that a legal barrier or is it a practical one for knowing when coverage begins? Because, for example, with the sentenced population in the county where there's widespread early release, I'm sure that's just a speculative when they're going to actually be released.
Yeah,
theoretical.
That's true. I think it's most strongly felt for pretrial populations, but you're absolutely right. It can definitely affect sentenced populations as well. And I think basically, and anybody who's working on this can also help me out on this, but from my point of view, it's basically that there needs to be a solution that's fairly simple that counties can implement where they can process an application for somebody who is in custody and place them into an aid code that's not going to be expending money while the person is in custody. It's a little easier if you know their release date. You can just process it up to that point and then say, like, okay, on this date we'll put them in a full benefit aid code because that's the day they're getting out. If we don't know, we might, the person that's processed that may not know until later, oh, they got out a couple of weeks ago, I had no idea, or oh, they're getting out today. And so it's a little bit more difficult to actually move forward with processing the application. So I think there are actually some counties that have developed some solutions in this area. San Luis Obispo is one, and they're going to speak on this webinar that's happening on Wednesday as well. But they basically are processing all inmate applications and placing those individuals into the inpatient aid code, which basically is not full scope Medi-Cal benefits. It only provides reimbursement for inpatient hospitalization costs. And then they're communicating, they have a really close sort of reporting between their sheriff's department and their social services department, so they know on a daily basis who's released, and then they just move those folks from that inpatient aid code into a full scope Medi-Cal aid code. So that's one solution that I think is fairly simple to implement. It's just a matter of sort of identifying some of those solutions and then making it clear to other counties that that's something that's permitted in terms of the use of that inpatient aid code for people who aren't imminently going to be hospitalized. And here's our contact information. This is me, Jenny Montoya, Tansey. As you can see, I'm going to be out in October, so you can feel free to email Elizabeth for your needs in the late part of the year. But Oh,
So
gosh.
we're going to wrap up. Thank you all so much for coming. As Jenny mentioned, we will continue to do problem solving with counties, DHCS. We're also working with the California Welfare Directors Association in addressing a number of these issues and challenges that have come up. We will be further refining some of the survey results, issuing a new toolkit with some of that. There'll be a number of webinars, and we also will be making this briefing this morning available on our website. And so if you need to contact, please feel free to do so. And also, I just want to thank Milena Blake, who is our Legislative and Policy Director back there. She's also available to follow up with all of you who are here in Sacramento, and Mike Smith, our Communications Director, for helping to put this together. Thank you all very much for coming. And thank you to CSAC for hosting. Thank you.